let me just draw it. So this is the image that we are going to be looking at. So we're going to be looking at the right hand side of the TMJ, but obviously this is going to happen on both sides. But for the next images you'll see, you need to envisage that we are zooming in on this circle that's going on here, just for the sake of orientation. So we have two movements of the TMJ. Okay, the first one is rotation, and then the second one is translation. Okay, so on all of these images, the nose is on this side, and then the back of the head is on this side. Okay, so the ear is kind of located sort of around here-ish, something like that. Okay, so in order for the mouth to be able to open on a wide axis, we have these two movements, and we have a pattern. So we have rotation, translation, rotation again. So this is the condylar head, the condylar process of the head, and then this here is the articular disc, okay? And this is attached to the lateral pterygoid muscles. And the lateral pterygoid muscles are going to pull this articular disc forward until it makes contact with the articular tubercle, which is here. So this is the articular tubercle. The articular disc is going to move forward because of contraction of the lateral pterygoid muscles. That's the overall aim. Okay, that's the overall aim of what the lateral pterygoids are doing to this articular disc. Now, in the rest position, the condylar head is very well secured within the mandibular fossa, which is this bit here. And I apologise that they're all in red, but for the sake of speed and brevity, I'm not changing colours. Okay, so that's really nice and snug in there. In order for us to open our jaw, we have a primary rotation. So that's looking at this image here. We have primary rotation, in which we have a slight rotation of the joint of the condylar head within the mandibular fossa. And this is only giving us a few degrees of opening the mouth. So like the first couple of degrees. So this is literally just separating contact between the maxillary and the mandibular teeth. And you can see that the lateral pterygoids are now starting to pull this articular disc in this direction, okay? And then we have translational movement. Now, translational movement just means that everything along that same part is being moved together. So the teeth are in a fixed position on the mandible. The mandible, ramus, etc. is in a fixed position in relation to the condylar head. So what is happening here is almost like a controlled dislocation. Okay, so this is exiting the mandibular fossa. So if you compare that to what we saw in the first image, this space here, very small, this space here, very big. So it's a controlled dislocation of the mandible, of the condylar head. Now, the lateral pterygoids are continuing to pull this articular disc until it is making contact with here. Okay, and that is what's happening on this fourth image. Now we have further rotation. Okay, so we have a secondary rotation. So this is where the mandible is swinging open. Okay, so it's swinging open. So if we imagine the teeth here and here, we are getting a much bigger gap between the maxillary and the mandibular teeth. This articular disc is in contact with the articular tubercle, and that allows for movement, a smooth movement and no rubbing, because obviously we don't want bone on bone rubbing because that would be incredibly painful. So this is allowing for a smooth movement within the hinge action of the jaw. So this is the secondary rotation. Now you don't need to know it in this much detail as yet. We do look back at the TMJ We have a review of the TMJ in years 2 and I think years 3 as well. So don't worry too much in great detail. We only need to have a basic understanding. So the basic understanding is that we have rotation, because without this primary rotation, you cannot have translation. Okay, you cannot controlled dislocate this joint, this TMJ, without primary rotation first. And this articular disc is slipping forwards, making contact with the articular tubercle to protect bone-on-bone action. We don't want bone-on-bone action. And then what is happening in reverse is exactly the same, but it's the opposite way. So the lateral pterygoids begin to relax. Okay, so these are beginning to relax. So therefore, we have movement of the articular disc, which is travelling back into the mandibular fossa. So it's all moving back this way, this way, this way. Then we have translation. So this is controlled relocation in this case. So this is moving back up in this direction. And then we have the final rotation backwards, which is closing the teeth off again. Now, let me erase all of this, or let me see if I can work out. Erase all of ink on slide. Perfect. So, sometimes, and you'll see this when you look at TMJ dysfunction more, particularly as you sort of enter clinical practice and stuff, is that sometimes this disc here, this articular disc, can fail to slip back into the joint. Okay, so it can fail to move back as you're closing. Now, when this happens, what we have is the condylar head moves back into the joint before the articular disc is there to protect the rest of the joint. Okay, so that protects the mandibular fossa. And what happens is we have this loud popping sound and then a like pain. Okay, so it's uncomfortable, it's painful. And this is what we call TMJ dysfunction. Okay, it's quite common. And at some point, I imagine that we will all have, like these one-off kind of incidences of popping or clicking joint. That's nothing pathological to worry about. If it's happening on a regular basis, that can be the beginnings of sort of a TMJ dysfunction. So it's TMJ dysfunction is like a big umbrella term, but largely TMJ dysfunction is caused by this articular disc failing to slip back into the mandibular fossa when we close our jaw, and it is painful and we get this popping sound. I hope that clears it up a little bit more, but obviously feel free to tell me that what I told you didn't help at all, and I will try and demonstrate it with a 3D model rather than image.